Congrats, grad! You finally finished school. Are you a new medical assistant, a CNA, or a phlebotomist? Whatever it is, welcome to healthcare where the fun really begins. Are you excited to start working but nervous about your skills? Does blood still give you the ick and nervous to do blood draws? Look, being nervous is super common. All blood draws are different because every patient is different. Every medical professional is taught differently on how to perform venipunctures, but just remember to stay confident and remember these steps. Hi, I'm Nikki, and I've been a medical assistant for almost 10 years now. Blood draws are something that I feared in my early career, but I've learned to overcome that fear and perfect my skills. Here are some of my tips and tricks on how I collect the perfect blood draw via venipuncture. Remember, there are 3 very important steps to collecting a blood sample. 1 is understanding the human anatomy, 2 is preparing a clean and sterile space, and 3 is following all proper steps for collection. There are many veins that run through a patient's arm. Knowing your anatomy can help you differentiate which is the best vein to draw from, without causing harm to the patient or to the specimen. First, you have your cephalic vein, which runs out on the outer layer side of the arm. Then you have your median cephalic or the cubital vein. This crosses the center connecting the cephalic and basilic veins. This is usually the best choice. You then have the median basilic vein. This vein branches off of the median vein, often connecting to the basilic. Then you have your basilic vein. This runs up the inner medial side, closer to the brachial artery and the median nerve. Why is it important to know your anatomy? Well, you have superficial veins that are closer to the skin's surface and they're easier to see. You also have well-anchored veins like the medians, cubital, and the cephalic veins. These are less likely to roll during the blood draw. These all have good diameter. Veins become engorged or larger when you tie a tourniquet. Once you have found your selected vein, it is then time to set up your clean station with all items necessary. You're going to set up your clean surface space where you have all items gathered and ready to use in order. First, you have your placement sheet, then your hand sanitizer, gloves, a tourniquet, alcohol pads, a butterfly needle, then your hub, a blood collection tube, clean gauze, and a bandage wrap. After your final check of vein selection and necessary items, you are ready to start your venipuncture. You're going to start by washing your hands with soap and water or hand sanitizer. Find the placement of your patient's vein. Don your clean gloves. Tie your tourniquet approximate 2 to 3 inches above the puncture site. Clean the puncture site with alcohol pads for 30 seconds. Grab your needle with the hub. With one hand holding the hub, pull the patient's skin down and hold taut. Do not let go. With your other hand, grab the needle securely and puncture the selected vein. Watch for the flash inside the needle. Grab the collection tube, place it in the hub, and fill tube. Once the blood is flowing, release tourniquet in one swift pull. Take out tube and place on a clean surface space. Take the clean gauze over puncture site while retracting the needle. Wrap gauze tightly with bandage to prevent any bruising. Make sure to discard of all materials properly. All trash that has not been contaminated will go into a regular trash bin. All needles must go into a plastic puncture-proof sharps container. Any materials that have been contaminated with blood or bodily fluids must be tossed into a biohazard container. Make sure to lastly wash your hands with soap and water. Knowing the anatomy of your patient can set you up for a smooth procedure. This will prevent any harm to the patient and give you a clean specimen without any errors. Having a clean surface space will keep your procedure organized and safe for yourself and your patient. Patient safety is always key. Being nervous is normal, but easy to overcome with practicing these steps. 1, understand the human anatomy. 2, preparing a clean and sterile space. And 3, following all proper steps for collection.